A modern cardiac catheterization laboratory is built around combining high resolution real time imaging with precise hemodynamic monitoring and immediate resuscitation capabilities. Here is a breakdown of the core equipment that makes up a standard cardiac cath lab. Imaging and fluoroscopy hardware. The C-arm, the centerpiece of the lab. It houses the X-ray tube, usually under the table, and the digital flat panel detector, image intensifier in older models, above the patient. It allows for multi-axis cranial caudal and RIO-LIO angulations. Radiolucent patient table, a motorized free-floating carbon fiber table that allows smooth panning and panning without interfering with X-ray penetration. Suspended monitor banks, ceiling-mounted booms carrying multiple high-definition displays. These show live fluoroscopy, reference loops, hemodynamic data, and secondary imaging modalities like IVUS and OCT. The polygraph, a multi-channel physiological recorder that continuously processes and displays the patient's ECG, usually 12 lead, SpO2 and non-invasive blood pressure. Invasive pressure transducers connected to fluid-filled manifolds. These provide real-time beat-to-beat pressure waveforms from the aortic root, left ventricle or pulmonary artery during right heart caths. Automated power injector, essential for delivering precise volumes of iodinated contrast media at specific flow rates, example for left ventriculography or aortograms. Manifold system, a sterile setup of stopcocks allowing the operator to seamlessly switch between pressure monitoring, contrast injection and saline flushing. Resuscitation and mechanical support. Given the high acuity nature of the procedures, rapid response equipment is kept directly in the room. Biphasic defibrillator, usually with pacing capabilities, kept continuously attached to the patient via radiolucent pads during high-risk cases. Crash cart, fully stocked with emergency ACLS medications, intubation gear, and temporary transvenous pacing kits. Intra-aortic balloon pump console or other temporary mechanical circulatory support systems like Impella for patients in cardiogenic shock or high-risk PCI. Intravascular diagnostics. While technically add-ons, these are now considered fundamental in modern labs for optimizing stent deployment and assessing lesion severity. IVUS OCT consoles, intravascular ultrasound, and optical coherence tomography machines for high-resolution cross-sectional imaging of the coronary lumen and plaque morphology. FFR IFR systems, consoles to measure fractional flow reserve or instantaneous wave-free ratio to determine the physiological significance of intermediate stenosis. Radiation safety equipment, shielding, ceiling suspended lead glass shields and table-mounted lead skirts to protect the primary operator from scatter radiation. Personal protective equipment, lead or non-lead equivalent aprons, thyroid collars, leaded glasses, and real-time personal dosimeters.